Hi, my name is Hugh, and I'm doing the skin disorder called hives. So, signs or symptoms of hives. Hives are like how you can know if you have them is if you have red splotches on your skin, and then the more that you scratch, the more they spread. Like they fade more, like the more they fade. And it's shaped as like circles, but they could be shaped as like splotches. Etiology disorder. Hives, they're red. They're very itchy welts. The result in skin reaction. The welts vary in size and appear to fade repeatedly as the reaction runs its course. So the more you scratch, the more, like, if you scratch down, they'll go down. And then you scratch, like, they'll just spread the more you scratch. The condition is considered chronic. So, and then the welts appear for more than 6 weeks and reoccur frequently over months or years. So they could come back. Like 1 week they'll be there, and then the next week they could be there again, or the next month they could come back. It's detection methods or diagnostic tests. Okay, so complete blood count. So they take your blood, and C reactive protein are important investigations for diagnosis of infections and urticaria. So yeah, you could take tests to see if you have it. You could take tests. You could do, but you also know if you have it just by looking at your skin. Past treatments performed for this disorder. So some treatments were bathing in anti-itch solution. So you just like put the anti-itch solution on your body, or you could just like have it in wherever submerged. Apply aloe vera, because aloe vera is like a very good substance for skin, so it helps a lot. And then avoiding irritation, which means like don't scratch, just leave it there and just let it go away. Current treatments performed through advancements in medicine. So chronic hives have been treated with antihistamines or combination of medicines when they don't provide relief. Oral, my bad, is also approved to treat chronic hives in those at least 12 years of age. So there are medicines for it, but you have to go get the medicines, and it's a biologic drug called Xolair, and it's approved to treat chronic hives. So that's what you would use if you have it. Risk factors is you could take medicine, well, you could get them from medicines, to allergic shocks. So if you're allergic, you could get it. Infections, like if something gets in your skin, you just start itching, and then you start getting insect bites or stings. So if a mosquito bites you or a bee stings you or anything, like any animal, and your body, like your skin, doesn't go with it, you can start getting hives. Latex, if you're allergic to latex, pressure, or cold or heat. So it just matters what your skin's used to or not. Probability of success outcome. So you won't die from hives. Maybe you could, but you could just leave it alone and they'll go away, or you could take medicine. They usually last a few hours or a day to go away on their own. However, episodes can continue for varied periods of time. When hives occur deep in the skin, the condition is known as angioedema. There is no specific test or diagnosis hives caused by allergic reactions or other factors. So they would just go away by themselves, but they could come back. Additional information about hives. So another word for hives is urticaria. It's It's obviously an outbreak of swollen, pale red bumps or on the skin. It's a reaction to your body and your skin, and about 20% of people get hives, and they could always come back. The itch can drive you crazy. It can make you just crazy because it itches so much, but you can't scratch it or just get more. And spread become even more, more all over your body. It could just start with like a few bumps here, and you could scratch, and they'll be all right here, and you scratch more, and it'll be all right here, and you keep scratching. It could get on your face and everywhere. It doesn't matter where. And then those are my sources. Thank you for listening to me.